Hello, welcome to the VR scenario discussion. You have just viewed the first part of Billy's visit to the pediatrician. In this first portion, there are several aspects of the interaction the doctor can improve upon. Although seemingly minor, it can make a big difference in getting an anxious child to cooperate in a medical setting. You no doubt have noticed that the doctor directed most of his questions about Billy to his mother. By putting yourself in Billy's shoes, you notice that there was not much eye contact. Many of us can be guilty of that, focusing on the parent whom we expect answers from, rather than the patient, who in this case is little Billy. Additionally, the doctor used the word injection multiple times during the procedure. Although unintended, Billy, who has had injections before, will be frightened by this and become more anxious. The doctor even asked the nurse to prepare for a shot within earshot of Billy, something which seems innocuous but can have detrimental effects on the visit. It is therefore important to be aware of the surroundings, what the child can hear or see, and not leave the needle in plain view of the child before an injection. Sometimes, when we try to explain a procedure to a child, it can be difficult not to use technical jargon. However, using words like vaccination and immunization can confuse the child and make it tough to get the message across. It is also important to consider the point of view of the child. Sometimes, when we tower over a child, it can be intimidating, making a procedure a lot scarier than it actually is. Even something trivial like speaking to a child from behind a large desk has the effect of making it seem like the child is in the principal's office after getting caught doing something wrong. Sometimes, to convince a child to cooperate, we may say things like the injection is not painful. Unfortunately, it does not help, as the child had prior experience and know that this is not true. And this act of untruthfulness can destroy any trust between the doctor and child, making future procedures even harder. In this case, the doctor tells the mother to hold Billy tightly, suggesting to Billy that it will be unpleasant. Furthermore, just expecting the child to cooperate for an unpleasant procedure just by promising it will be fast and not very painful may not be enough. In this situation, the use of distraction can be very helpful. By finding out something the child is interested in and engaging the child can help take his mind off unpleasant sensations. There are other minor points like the tone of voice and non-verbal communication such as smiling, which can be improved. Feel free to rewatch the first part and apply what you have learned previously to see if there was anything else you would improve upon. When ready, please proceed on to the second portion of the scenario to see some of the techniques we discussed in action.